Well, welcome back. Joining me now is Dr. Teresa with UT Tyler School of Health Professions and George with Net Health. And they're here to share about National Public Health Week. How are y'all?
Hey, we're doing great.
Good.
How are you?
I'm good. So glad to have y'all here.
Thank you.
First off, I just want to know, what is Public Health Week?
Well, National Public Health Week happens every year, the first full week of April, and it was started by the American Public Health Association, which is our large sort of national organization. And it's really just a way to celebrate public health and the many things that public health has done for our folks, our populations.
Yes, and so why is public health so important?
Well, public health is important because since 1900, 30 years have been added to the average lifespan of Americans. So we're all living 30 years longer now, but of those 30 years, 25 are due to public health initiatives such as clean water, safe food, vaccinations. So you think about how safe do you think the food was in 1900?
Probably not very safe.
And probably the water wasn't very clean either.
No.
We did not have life-saving vaccinations like, you know, when Teresa, before we were born, really, the polio vaccine came out.
Yeah.
And just think, our parents, what they went through with children, the danger of their kids getting polio was amazing. And now, you've never probably seen an iron lung before. You've never heard of kids getting polio, and that was commonplace in the 30s, 40s, and 50s.
Yeah, it was everybody was scared to death of polio.
Yes, I mean, this is all the whole...
My uncle died as an adult of polio.
Oh, wow.
It was still around, you know, but the vaccine was out, and then the new vaccine came, the sugar cube, and, you know, so I got vaccinated a lot for that one.
Yes, I mean, but just the whole polio really started the vaccines, and you have all these have come up.
Smallpox.
They save lives.
Yes.
The vaccines save lives, so clean water saves lives, safe food saves lives, and then the other 5 years of advancement are due to medical care.
Right.
So basically all about the things of life that taking care of ourselves.
Yeah.
Yes.
And public health is really about taking care of whole communities instead of individual patients. So our patient is not the individual, it's the whole community.
That's right.
Yes, and so tell me, you know, what's this year's theme?
Was ready, set, now.
Oh, okay.
Ready, set, action.
Action.
Oh, action.
Yeah, I missed the name. But basically, what's been nice is with Dr. Bird and UT Tyler, Net Health we started partnering together 3 years ago. We said, why are we doing things separately here? So we started partnering to try to get the word out a lot better through the university, through us. And so we've got several activities going on for the public to be aware of next week.
Right,
So
yeah, a lot
the
of
first
stuff.
one is?
The first one is on Monday of Public Health Week, which is next Monday. In the evening at 6 o'clock, we're going to be at the African American Museum for a Mental Health Monday. And it's going to be really cool. We're going to kind of kick off Public Health Week. We're going to give some awards to some folks who made videos that we're judging. And the Texas College Choir is going to sing. And then we're going to have some folks talking about the importance of mental health and how we can maintain our mental health. So that's going to be really cool. And I've never been to the African American Museum, so I'm really excited to see that.
Yeah, this is going to be a great kickoff to the week. And then on Tuesday, the Fit City Tyler Health and Wellness Expo will be from 4 to 7 p.m. at the Tyler Rose Garden.
Okay.
And we want to invite the community to come out for that. We've got all kind of health screenings that day. We're going to have yoga at 4, a walk with a doc at 5, Zumba at 6 in the Rose Garden. But then all kind of, if people come in and get the health screenings, they're going to be eligible for prizes. We're going to have $50 Brookshire gift cards, gym memberships. So we really want to encourage the people to come out because we want everybody to take charge of their health in 2026.
Yeah.
Yes.
And Wednesday at the North Campus of UT Tyler, we're going to have in the morning a nutritionist is going to speak, and she's going to do a little cooking lesson on cooking healthy food and snacks. And we're also going to have some films running about public health and a little virtual tour of the SIM Center that our medical students and our nurse practitioner students use. So that's going to happen on Wednesday. And also the mayor is going to make a proclamation that morning.
Okay.
And Tuesday, the Smith County, the county judge and commissioners here in Smith County are going to do a proclamation. So
right. And then on Thursday, we have two things going. One on the main campus, the academic campus, and that's going to be from 12 to 2 for students and anybody else who wants to be on campus. about sort of demonstrating CPR
Okay.
and how to use AED. And on the other campus, we're going to be having a lifestyle medicine conference that's all day long. And then Friday, we have Grand Rounds at noon. Everybody's invited. You don't have to be a physician to go to Grand Rounds. It's there on the North Campus. We're going to have a panel, and I'm excited about the panel because this Ready, Set, Action tells us that everybody needs to take action. And we know that it's not just us people who work in public health who do public health. Engineers do public health. You guys do public
Yes.
health.
Tori does public health.
Yes.
Yeah. So we have a panel of folks who are not just public health professionals, but also we have an engineer, we have a journalist to talk about how they impact the health of the population.
All righty. Well, thank you all so much for joining us today.
Thank you for having us
Thank
today.
you. It's good to see you.
Yes. And for more information, you can go to that website right there on your screen.